Hey everyone, what's up? This is Dr. Charlie Johnson, physical therapist. Hope you are well wherever you are. Appreciate you checking out this channel. And in this video, I have 3 super practical tips for you if you have pain, back, butt, and or sciatica pain. Oftentimes people with sciatica type symptoms or these back problems get shooting pains down the leg. If you're rolling over in bed, so this video is perfect for you if when you roll over in bed, maybe first thing when you wake up or, maybe at night or whatever, you have some type of pain, again, in your back, butt, and or leg. So before we talk about what those 3 solutions and or practical tips to try on might be, my name is Dr. Charlie Johnson. I'm a physical therapist. I have my orthopedic specialty, and I help people with back, butt, and sciatica problems all around the world basically learn to fix themselves using the power of their mind and movement as medicine. Also, if you're wondering what the heck is going on and what the pain could mean and or could be that's shooting down your leg, be sure to check out my Better Than an MRI DIY diagnostic guide. Click that link above to download it. All right, so first tip, all right? First 2 tips are a little bit of an avoidance strategy, but they can allow your mind and your body to sort of calm down regulate the nervous system and or any tissue in your back or your butt or your leg that might be irritated. All right, so the first thing you're going to do, all right, in this specific example, I was inspired by a woman I recently chatted with who, for this example again, I had pain shooting down her right leg, all right, and she slept on the right side of the bed. So she got out on her right side. Just rewatch this video and apply the concept, and take it with a grain of salt and apply it to your own unique situation. All right, so first things first, she had pain shooting down her right leg when she rolled to her right side. So, avoidance strategy, I said, hey, can you sleep on the left side of the bed for the next 3 nights, and then we can come back to see what does that do, all right? Because if every time you roll over on your right side, you begin to experience pain, or you do experience pain, you start to link psychologically and mentally, start to wire this link between rolling over equals bad. Rolling over is bad, rolling over equals pain. And what happens? You start to become fearful of rolling over. You start to think, oh my gosh, I've got to go on this trip, and I wonder if I'm going to be able to get out of bed in the morning. Or, you know what, when I wake up, before I even try to do that thing, I wonder if this is going to be super painful, right? And so you start to condition yourself, you start to develop a learned response and wire this link between rolling over and pain. You actually teach yourself, just like a dog can be trained to salivate at the ring of a bell, right? You can be trained to experience and set yourself up for pain, right? And train your reaction to certain activities. All right, so try sleeping, step 1, on the opposite side of the bed. All right, just try it. Doesn't matter if you have pain in your right leg, whatever, just try it. The next thing that you might want to consider and or try on is, let's just say you've got a grumpy partner or a grumpy dog, or you don't have another side of the bed because it's too small, whatever it is. All right, try staying on the same side of the bed, but rotate. Rotate your head such that your head is at the base of the bed. All right. Now, what does this do? You might think this is weird. Well, a lot of times, people have had mattresses for many years. I know. The mattress I sleep on, it's going to sound gross, but I think my wife's had it since she was like 12 or something like that. I'm not that old, but let's just say roughly 20 years, all right, probably with this mattress. And I feel totally fine. It's no big deal, all right? But, there's a little bit of a dent. You sleep in the same position every single night. So sometimes just by shifting the load and or the weight, so rotating your body 180 degrees so your head is at the base of the bed or the foot of the bed instead of at the top, can absolutely make a change in how you feel. I know it sounds funky. That's one way you can kind of change the sleeping environment such that you can potentially have a different experience when you roll over or move, okay? That's the second thing. Now, again, notice that these are kind of avoidance strategies, right? These are ways to help you avoid the pain, not from a place of fear, but from a place of experimentation, saying, hey, I wonder if I do this, if it helps. Okay? Now, you could argue, well, hey, I'm going to do that, and I'm kind of just avoiding the pain, so isn't it just going to come back as soon as I get back to that position, or as soon as I want to go back to that? Well, maybe, but remember, we're not asking you, okay, to do this for forever, all right? So the cool thing about using movement and the mind as medicine is if it doesn't work, ditch it. So try those first 2 kind of tweaks or different strategies for maybe, a couple nights each, right? And you're just trying to ask yourself, same, better, worse, all right? Now, the final strategy that you can do is you can, there's kind of 2 mini strategies within this, you can use movement as medicine, all right? So right before, if you know that rolling over is a problem for you in bed, like this lady who reached out to me. She said, Charlie, as soon as I pull my legs up and bend my legs up, sometimes I get pain there. And when I have my legs up and then I go start to roll, that's when I get the shooting pain down my leg. So you're going to want to, if movement were a pill, a medicine you could take that could keep the pain from coming on when you would roll, would you take it? Of course you would. There's no side effects. Try it on. All right, so I'm going to show you two things here in a moment that you can try on before you roll to see does it help or does it not help, and then the value in doing this, because it goes a little bit deeper than just trying this thing to see if it works. It can actually tell you a whole lot about what you need to do potentially to solve the problem long term. All right, so we're going to go inside here. All right, so I'm going to pull my wife on camera here. I'm going to show you exactly what I would do to problem solve this pain while rolling over in bed issue. Here we go. All right, so here we are with the beautiful Miss Heather Johnson. She's got her seasonal attire on as we work into fall. And so let's just say that as you roll, all right, you get the shooting pain going down the leg. Now, you're probably sleeping, so unless you sleep with your legs up, you're probably sleeping like this or something like that. All right, so first things first, a little tip, all right, that most people don't think about is that if your back is sensitized, meaning if your back is irritated and sensitive, you've got a sensitive back, lifting your leg like this to bring your knees up before you roll over, it's not right or wrong, but if your back is sensitive, contracting your hip flexors, which connect to your spine and your abdominal muscles. In the morning when disc pressure is highest, again, I'm alluding to disc. You may not have a disc problem, you might have something else, all right? But either way, sometimes picking up the leg can cause more pain, just like the woman I was chatting about. Charlie, sometimes I just lift my legs, I get a shooting pain down the leg, all right? So instead, think about not activating the front of the leg, but think about using the hamstrings to bend the leg up, meaning push your heel gently into the ground and slide the heel up. One leg, slide the heel up. And if you do it the right way, your socks fall off. All right, that's how you know you're doing it the right way. All right, and so that's one way to do it, little kind of heel slide trick. All right, but the other thing you could do is if you get in this position, or let's just say you don't even want to pull your legs up. You have probably a pillow or something like that. I'm using a ball. You probably don't sleep with a ball in your bed, but use a pillow, all right? And maybe you sleep with a pillow between your legs or between your knees or something like that, right? Just go ahead and give it a squeeze. So go ahead and squeeze it. Don't make it painful. You don't have to hurt yourself. You're shaking. All right? Just a gentle squeeze, never painful, all right? Get a little bit of work through your inner thigh and a little bit of kind of contraction through your hips. Maybe a 10-second hold, 20-second hold 3 times. Just kind of consume that thing as long as it feels safe. And then relax. Then go ahead and do your roll. All right, so then you could go and you could do your roll. And you're going to ask yourself, same, better, worse. So again, roll on the back. If movement and or an exercise can be used as medicine, and rolling over is when you're going to get your pain, then you could do it right beforehand. All right, and so some type of what we call co-contraction or activation, squeezing of your ankles together, your knees together, sometimes even pushing apart. Heck, it could even be you take this, you start here and you push your legs gently maybe down into the table. So you can feel a little bit of work through the back of your legs probably and things like that. It could really be anything, all right? The idea is you're trying to test for different inputs and different ways to go about kind of working your body immediately before you roll from below the belt line to see does it change your rolling experience, all right? Now let's just say that doesn't do anything. You're like, Charlie, my socks fell off. I did the little heel slide thing. I squeezed my pillow, nothing. Well then, above the belt line, if this is the fulcrum of the body, you can work on kind of squeezing or contracting this, all right? So what you could do is before you roll, put your hands like this, go ahead and gently push down into the bed or into the table here, and you'll feel it working here a little bit. You got that? All right. Again, maybe a 15, 20-second hold. You don't have to do it really hard. It should be, again, pain-free, all right? But feel it working. Hold, 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 hold. Keep breathing. Push, 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 push. Break. Maybe 3 rounds of a 15, 20-second hold, and then go roll. Go ahead and go roll. Same, better, worse, right? And then final little test is hold that contraction as you roll. All right, so as you push down on the table, you feel what that's like. Yeah. Got it? Can you put your hands here on your belly? And can you do the same thing? Yeah. Perfect, as you roll. Okay, so you can kind of preset yourself or engage your belly. Notice I don't say core because There's not a whole lot of evidence to say like, hey, if you strengthen your core, you're gonna have less pain. It doesn't really matter. We're not talking this or that. Notice how I haven't even mentioned a whole lot of diagnostics. I'm just saying, hey, we can start to test different ways to move the body and give different inputs. From above, a little bit of like a belly squeeze, right? From below, a little bit of like a ball squeeze or a pillow squeeze, or a little bit of like a heel crush, a heel dig. And we can manipulate the way that we're going through this process, and we can use movement right before we go to roll to see if we can reduce that pain in your back, butt, or leg when you roll over. All right, so this is the third way how you can use movement as medicine if you're having trouble rolling over. Now, here's the cool thing, all right? So let's just say that, I'm gonna take this off tripod. Let's just say that when she's doing that, I don't know, little pillow squeeze, let's just say that it really helped her, all right? She was like, wow, like I did that like 3, 15, 20-second holds, and I rolled over, and Charlie, I was pain-free. I'd be like, aha. So now that you tweak, oh, here's another thing. You could actually keep that squeeze. Another final idea. I know I'm giving you a lot of ideas, but you could keep that squeeze and you could roll over at the same time. Keep it squeezed and roll. Now, that's kind of weird. A little funky, right? But it's an option. So you see, like, I'm not so glued to like, oh, well, like, where'd that exercise come from? We just made it up. We're testing inputs. We're being systematic and scientific. Test, treat, retest, and we're using movement as medicine. All right? Now, let's just say that she loved that. After she did that thing, it reduced her symptoms. She can now roll pain-free. Awesome. Well, now, what if she could bottle that thing up? She could take that pillow squeeze exercise, put it into a little pill bottle, you know, one of those orange ones that you have in your cabinet, and you could slap a prescription label on it. Dose, frequency, and timing. She could do that movement as medicine, not just in the morning to get out of bed. So we prove that that thing, that little tweak, that way of getting out of bed, takes away her pain with rolling. But then that gives us evidence. It gives us a clue that, hey, if you bottle that sucker up and you do it at a certain dose, how much, frequency, how often, and you time it in the morning and then more frequently throughout the day, that could actually be part of the solution. All right, so you can see how we start to link things, and hopefully that's helpful. All right, so 3 things just to recap real quick. All right, 2 avoidance strategies. You try sleeping on the opposite side of the bed. You see what happens. Or you try putting your head at the foot of the bed. Give it a try. All right. 3rd thing, think of using movement as medicine. All right. If you have pain when you're rolling over, do a movement right there in bed beforehand and test to see if it fixes your rolling problem. All right. And then once you find that, if you find that, you can bottle that sucker up, slap a label on it, dose, frequency, and timing, optimize the movement prescription for you and your specific needs. All right, hopefully this is helpful. Let me know your thoughts in the comments. Was it valuable? Was it not valuable? And yeah, let me know if you have any questions. Thanks.